Hi, I'm Dr. Amy Robbins, and welcome to Life, Death, and the Space Between podcast. I'm a licensed clinical psychologist and medium, and here we explore life, death, consciousness, and what it all means. Today, I have an amazing guest, a woman I've been following for a while now on Instagram. She's also on TikTok and YouTube, and she has really made a name for herself in the field of hospice and death and dying. And Julie McFadden is a BSN RN, and she's been a nurse for 15 years. She's an experienced ICU and now hospice palliative nurse. She's been featured in Newsweek, USA Today, The Atlantic, The Business Insider, Medscape, People, BuzzFeed, and several other articles worldwide. Julie, like me, is passionate about normalizing death through education to the masses using social media. Her TikTok has 1.1 million followers, and you can find her on every social platform at Hospice Nurse Julie. Welcome, Julie.
Hi, Amy. Oh my gosh, thank you so much. And so it makes me blush when hearing that.
I need your support. If you've been listening to me for a while, or even if you just started, you can go to Patreon and put in Dr. Amy Robbins. And there you can find different levels in which you can support the podcast financially. At this point, I have no ads. I have no sponsors. I am solely self-funding this podcast, and it would really, really help me out if you've gotten something out of this podcast. If you could donate $5, $10, or even $20 a month just to help me out, to help support the podcast. I'm continuing to work to try to get sponsors, to try to get advertisers, but until that happens, I need your help. And there are other ways to support the podcast. In addition to Patreon, you can like the podcast, you can subscribe to the podcast, you can rate and review the podcast. I always love reading your reviews. They're really heartwarming to me, and it's the emotional currency that I get from providing you with this resource. So please take a moment to just help me out here. You can also find the links in this episode, in the episode notes, as well as on my website at dramyrobbins.com. And don't forget to follow me on Instagram at Dr. Amy Robbins. It's just so amazing to see how you really built such a following, like a cult following around death and dying, which I think just speaks to people's curiosity about it, their interest in it, their voyeuristic nature around it, but no one really wanting to talk about it. So you just put it all out there.
Yes, you said it perfect. Before I started the social media thing, I think, I didn't, in my real everyday life, when you try to talk to people about death, you can meet a lot of resistance. So I knew I had something to say, and I just didn't know if people were going to want to listen. So to see that people do, and then to find other people like you, and just being on social media, you find other people who are doing the same thing you're doing. And you're like, wow, there's a whole worldwide group of people that are interested and like willing and ready to learn and ask questions. It's been really, really great.
So you did not start as a hospice nurse. You started as a traditional nurse. You were in ICU, and you made this shift because you were really not happy, right, with the traditional kind of nursing. What would make someone want to go from nursing to hospice nursing, what seems like kind of the worst of the worst in terms of the human condition?
It's funny because first starting out, well, one thing, if there's any nurses listening, if you're not happy being a nurse where you are, try other areas. That's one amazing thing about, there's a bunch of amazing things about nursing, but the one thing is that you can try a bunch of things out, and it can feel really scary, but that is the best thing I ever did for myself, is try other types of nursing to figure out what the heck I want to do. But the hospice nursing, palliative care nursing, never on my radar. I feel like my decision to do ICU nursing came a lot from my ego, unconsciously, but now looking back, I want to be the best in my version. in my world, right in my head, ICU nursing was the best, the most intense. You're learning the most. None of this is really true. All nursing is great, but it came from it was an ego-based decision, I think. And I was very unhappy. I quickly understood this was not for me. And I still stayed there for like 8 or 9 years. I mean, within the first 2 years, completely burnt out, completely. I hated my job. Compassion fatigue. I did not like, I had to like hurry up and care. I hate the feeling of having to hurry. ICU nursing is like constant hurry. You're constantly in a rush. So I learned a lot. I'm so glad I did it because I learned so much. And I think it really makes me a great hospice nurse because I know the other end, the opposite end, which would be in the ICU trying to save someone's life. And that's what gave me the passion for learning about how to talk about death and dying, at least. I still didn't necessarily link myself going into hospice, but like a couple of years into my ICU training, I was like, we need to do better about talking about death because no one's talking about it here.
I was wondering about that, what it's like, because I think in, hospital settings, I was actually just talking to a woman the other day who lost her mother to cancer pretty quickly. And she was saying like, it was already like stage 4. I can't remember, maybe pancreatic cancer. And she was like, and they just told us to keep trying all these meds. And no one talked to us about the possibility that it probably wasn't going to make a difference. And we could have had a different experience had we gone a different route. Exactly. I know. I was like, exactly. And so how much did you talk about death and dying as an ICU nurse?
We did not. We did. And here's the thing. It's been a while now. It's been, a few years. So things probably have changed. And I don't want to blame anybody. No one's maliciously doing this. Right. But it just wasn't something we talked about. Like, and I was at a large teaching hospital where we would have these rounds in front of every patient's room with multiple doctors at multiple levels, multiple nurses, multiple, social worker, like a bunch of people on this team. And still, we would not mention like the big picture. And not everyone in the ICU is dying. Not everyone is, right? But many people are, especially the longer time goes, the more likely that is the case, right? And I wouldn't say never. There were a few doctors that seemed to have that little piece in them that was like, let's talk about palliative medicine. Let's talk about end of life. Let's talk about big picture ideas. So there were some that would do that, but they would rotate in and out of the unit. So that's how it just depends on which doctor's there. And what I found was once I was there long enough, it was like, oh, we just need one voice. Like I didn't realize that I had the voice until I said something. And it was like one person just needed to say something and it changed everything. All I had to say was, should we have a family meeting to talk about big picture? And everyone knew what I meant. Everyone there knew what I meant. They were all like, oh, right.
Right. Yes, so you were the one to give voice to what everybody was thinking, which is often the case with death, right? It's not like it's not there for people. Yes. I think it's constantly there for people. Just no one wants to say. No one wants to say it, or they don't think it's there. They don't think it's their spot. Like, especially with, and I don't want to get too off track. I'm sorry. You can reel me in if I do. No, but, someone with like metastatic cancer, right? Like a lot of times when they're in the hospital, they're seeing the kidney doctor, the lung doctor, the infectious disease doctor. Those doctors are like, oh, the oncologist can talk to this person about end of life. We're here for the infection. We're here for the whatever, and I get it. I get it. But then I think everyone's kind of passing the buck and being like, well, they'll talk about it. They'll talk about it. Maybe they'll talk about it. And we just and then no one talks about it.
And then no one talks about it. Yeah. Yeah.
So how did you end up choosing hospice?
I think I just got miserable enough in my job. I tried to do travel nursing and contractual nursing where you work, like I tried to work in outpatient. Like I tried to do like other little mini kind of nursing jobs and I still didn't like those. So eventually I just thought maybe I'll try hospice because there has to be a better way to die. And I feel like it's a little more natural and in the home and peaceful. So I should just try that. There was no big moment. It was just sort of like, there has to be a better way. And I think hospice might be that. So I applied and it said, you must have experience. And I didn't, but but I applied anyway. And then basically in my interview, I like begged them to allow me to try. I was like, I really want to try this. I think this is where I belong. And then I was right. It was like, oh, wow, and I loved nursing again. I love nursing again.
Can you differentiate for us? What is the difference between hospice, palliative care, and a death doula? Where do each of those pieces fit in this dying process?
So I'll try to do it quickly because it's kind of a little complicated. So like it could be a very long-winded answer. So this is just generally. So just generally, hospice, like the nitty-gritty is like you have technically to be on hospice. Someone had to tell you, a doctor or someone had to say you have less than 6 months to live. Okay, less than 6 months to live, likely, give or take, whatever, but likely less than 6 months to live. You can't get any kind of treatment. So you can't chemo, radiation, you can't go see like specialists, you can't get procedures done, you can't get like PET scans, CT scans, you're not supposed to go into the hospital anymore. If you do, you will come off hospice. So you can't. Like you are on hospice now. This is the benefit you're getting from Medicare. So it's also federally funded. So all hospices should basically act and give the same care because Medicare is the boss.
Can you decide? I want hospice. Like even if the doctor doesn't, like they could say, we don't know how much longer you have. Could be 6 months.
You can self-refer. You can self-refer, but it's easier to get a doctor to do it. But you could self-refer. But then the hospice company has to evaluate if you're actually appropriate. So just because someone could just be like, I want to come on hospice, if they're not appropriate, they're not appropriate. There's like really strict criteria we have to follow from Medicare.
Okay, got it.
And palliative care is not federally funded. So palliative programs can differ on what they offer patients. But palliative is a little more like symptom management. So I think palliative care should be in everyone's life. If there's something wrong with you, you should have like a palliative care doctor to kind of like look at you like big picture as a whole person to help manage your disease process. So you're usually terminal within a year or so. So there is like death likely to happen due to this specific disease that you're on palliative care for. But that's not necessarily true. So that's like a general statement, right? Not everyone on palliative care is dying. It's more of a symptom management program. So that's palliative. And then a death doula is something that is not regulated yet. So there's no like regulatory system for a death doula. There's no like certificate you have to get or something you have to pass to become a death doula. Now there are like people who train death doulas set up their own training and their own certification, but it's not like regulated by a system yet, which is like a good and bad thing, I think. So like the good thing is we're not regulated. We can do what we want. That's great. The bad thing is I think it's hard and I'm not a death doula, so I don't know, but it seems like it'd be hard for them to get paid. So from what I've been seeing, the way they get paid is through out of pocket. Like the family pays out of pocket for a death doula. It's not like a hospice company hires a death doula. Right. However, some may, but Medicare is not paying for that, right? Because it's not regulated. So they would be paying it out of their pocket. So I'm generally speaking there. But a death doula is it's like a birth doula. So someone who helps you through the death and dying process, either before you die, during, after, all three, if that's what the family wants.
So they might be more present than a hospice nurse who kind of comes in and out in that way, right? Yep. You come in and out to treat.
Yep.
But you don't sit bedside necessarily.
No. Right. No, not even necessarily. We don't. That's a huge misconception. I don't like it. I wish we could, but we don't. We don't. Yeah. But so death doula, I would love death doulas to be part of the hospice team employed by the hospice company. So we have that. So if that can happen one day, I would love that. But as of now, most people are hiring death doulas out of their own pocket. I hope I'm not speaking out of turn. I think that's accurate for my limited knowledge.
Yeah, no, I think you're right. I mean, anybody I know who's a death doula does it. They get hired by the family to come help. And then obviously it's becomes an exclusive person to be able to have, because if you can't afford it, you can't have that. And so it's really, and I think people struggle so much. I mean, they have hospice, but not all hospice nurses are the same. Right. And I think they don't understand what's happening in this dying process. So can you walk us through a little bit? Because you go you show some pretty graphic stuff online in terms of and you warn everybody and everything, but what happens as someone is actively dying? Like what is actively dying? At what point are you actively dying? Like, aren't we all kind of actively dying?
Yeah. Right. Yeah.
At what point do you determine like this is an active death? And what are some of the markers that we look for? This is not funny at all, but it is kind of funny that my fish died. My son's fish died last night. Yeah, I know. And he's out of town. So it's not going to be a pretty sight when he comes back. Yeah. But my husband was like reading about the fish and was reading that like if the temperature isn't right, that maybe that could be it. So he changed the water and the fish had like this burst of energy. And then like 2 hours later, it died. And I was like,
the
oh my
rally.
God.
He had the rally.
I was like, I'm going to ask Hospice Nurse Julie about that tomorrow. Do even fish have that same rally? Because my husband said he'd never seen him like that before. Like in months, the guy's been laying at the bottom of the tank. God. Suddenly he like swimming all over. And then that was it. So wow, that's my segue into let's talk about what happens when humans die, not just fish.
Yes. Well, side note, I have talked to some veterinarians who are amazing, and they do say a lot of the things that I talk about, animals go through too. So yeah, they didn't say fish specifically, but like like dogs and cats and whatever. But
I'm not sure my N of 1 validates anything, but maybe there's other people listening right now who have also had fish that have had the rally.
Yeah. Okay, so actively dying. That's like the term we use for people who are at the very end stage, which is usually a few hours. They can usually actively die for a few hours to a few days. I've seen someone actively die for like 2 weeks. That's abnormal, but it happens and it's okay. So that's when the body is, to me, actively dying is like the true biological process that like all of the built-in mechanisms that our body has to help us die. Like everything's kicked in then. Just like we know how birthing happens, but the fact that like our bodies just do it, right? And the baby just can somehow come out of the birth canal and survive and everything works. Death is like that too. There are things that are happening biologically in the body to make the body do certain things to die. So that's what's happening in the actively dying process. And it doesn't necessarily, if you're not used to seeing it, it can look, that's why I show videos that seem graphic. Now, in my mind, they're not, because this is what death looks like and it's normal. But everyone else, I get it. I mean, I do understand that people need trigger warnings. It can be upsetting, but that's my point, is to show that like, this is not, you're not seeing anything traumatic. This is what death looks like. People don't just close their eyes and go to sleep. Now, some people actually do. That does actually happen. But the majority, most people, no matter what you're dying from, if you're dying a natural death, I would call it, which is on hospice, meaning you're doing no interventions, you will look like this at the actively dying phase, no matter what you're dying from. Cancer, congestive heart failure, COPD, Alzheimer's, dementia, you're kind of all going to look the same in the actively dying phase to an extent. Before the actively dying phase is where you can differ a little bit as far as what your dying journey will look like.
Okay.
So the main things you'll see is usually people are fully unconscious. So fully unconscious. Their eyes and mouths are usually open, or at least partially open. They will not be taking food and water because they are unconscious. And they still will be making urine and having some bowel movements. So you'll still need to change them and stuff, depending on what's going on, depending on their disease, but that will be still happening. And then the biggest things that people get really freaked out about are the changes in breathing. So they will be breathing differently. They're not breathing like you and I breathe. or anyone listening is breathing. They breathe differently. But that's not because they're struggling to breathe. It's because the body is biologically and chemically and metabolically shutting down, and it causes you to breathe different. Mm-hmm. And I can like get into the chemistry of it, like your pH and your CO2, your O2, it's all not regulating. So it makes you breathe different. And then the changes in skin color can also kind of be alarming to people. It doesn't happen to everybody, but some people get a little gray, or they'll get blotchy, or they'll have mottling in their hands and feet, which kind of looks like sausage almost, like it's a veiny looking purplish. It doesn't happen with everybody, but also normal. And then the terminal secretions, or the death rattle, people will call it, which happens right before death usually. And people think their loved ones are drowning in their own fluid, because it kind of sounds like that. I mean, I get why, if you don't know what it is, you could freak out. But really all that is, and it happens to almost everybody, is secretions in the mouth, because your mouth is making saliva still, but your brain is not telling you to swallow it. So either your brain's not telling you to swallow it, or these muscles are not working, so you're not swallowing it, because you're just fully relaxed and unconscious. So that collects in an open mouth, and then with every breath, it sounds really wet.
Got it. Okay.
And we don't suction it because it creates more saliva. The more we suction, the more the body's going to create saliva. So we don't. We usually just let it go if families are okay with it. If they're really bothered by it, we can do little tricks. Turn the person on their side, let the saliva come out, medications to dry it out, but then they have dry mouth. So it's like it's a balance.
Like anything, you're always trading something for something.
Right. And that's what people look like, and I want to show that in real time, or not real time, but just show that through video. So people, it's not the first time they're seeing it. Right. This is what it looks like. This is all normal. The stuff that you're seeing is all normal.
And what about the rallies and the terminal lucidity that people talk about, those moments, in the day before, or whatever it is, that sometimes make people believe like there's a fighting chance here?
Yeah. So the rally is a phenomenon, because we don't actually know why it happens. There's theories, of course, but no one really knows. Usually happens in about 30% of our patients, or like 1 in every 3 patients will experience it. And it's usually right before the actively dying phase. So they're not actively dying yet, but it's like right before, where they're kind of sleeping all the time. They're still in and out of consciousness. And then suddenly they wake up and they're like, I'm hungry. And they have a personality. They look like they've almost made like a full recovery. Like it can be that drastic sometimes. And people, I think, kind of know better that maybe it's not a full recovery, but maybe they're not as sick as we thought. And they have a really good day usually, and then they die suddenly. So the thing that's really, that makes it the rally is if they're good and then they die. So if someone just has like a really good few weeks, that is not the rally. The rally is almost to the actively dying phase, shoots up and has a really good day or two, and then dies suddenly.
And there's no explanation for why that might happen. We don't understand.
No, we don't know. And I don't know if it's because people don't find value in studying death, right? I think like when you're end of life, like, do you want to spend the time studying, like letting someone study you, take blood, take this to try to figure out why this is happening? Because they might be able to take some blood samples and figure out this level goes up and this goes down and it causes, who knows, right? But so I don't know if it's that they can't get willing participants, or no one wants to invest in that because what's the point? I don't know, but no. So I don't know if it's like from lack of study, or we just can't figure it out. I don't know.
Interesting.
Right? I know. And then visioning. Oh, visioning is my favorite. So it never fails. People think I talk about visioning to like make people more comfortable, which again, I'm happy it does, but that's not why. Like, to me, it's the most fascinating part of dying. And I didn't know anything about it until I was a hospice nurse. Even as an ICU nurse, no one talks about this, but it happens so often that we actually educate, like it's in our educational books that we give families. It's a sign of death and dying, which is when usually a few weeks to about a month before someone dies, when they're still really lucid, they're still making sense. They're not like people always think it's because of lack of oxygen, like they're right on their last breath and they start seeing dead relatives. No, it's they're usually very lucid, and they will tell us that they're seeing their dead loved ones or dead pets or their dead friends or their parents, whoever it is. It's always someone loving. It's not someone they didn't want to see. And sometimes it's in dreams. I have heard people say my parents came to me in dreams, but most of the time it's right there in front of them. Their family visits them and either just hangs out or says like, hey, you're coming with us soon. Don't worry. We'll take care of it. It's going to be great. And that happens. I mean, I don't actually have a percentage on that one
right now.
I know. It's wild. It's so wild. It happens all the time. I mean, it's like people always want me to tell like certain stories. I'm like, I honestly can't, because it happens so often that like I forget, because it happens all the time. People all the time dying see dead relatives, dead loved ones.
And what do you attribute that to? Because I feel like most, traditional materialist doctors would say that's some chemical being released in the brain.
So I guess I love to say, I just don't know. Like, I know enough to know that I don't know. Right. The thing I do know is when people say like, oh, it's something like that, right? The chemicals being released in the brain to comfort people, or, oh, it's DMT, or it's low oxygen, or it's medications, things like that. So I've been a nurse long enough to know what like ICU psychosis looks like, what delirium looks like, what sundowning looks like, things that actually cause agitation or hallucinations or delusions or paranoia, like things like that. This is very different from anything like that. So I know what it's not. Right. It's not medication. It's not low oxygen, because they don't have low oxygen. That's a whole other story. But like, it's not the things that people try to use to explain it. Especially when you said like the doctors who say, oh, it's like, because there actually was an EEG done of a man who died, and the EEG showed that the like dreamlike state and memories and like flashed before this person's eye, in their mind before they died, which could be, I love that the brain does that for us. What a miracle. I think that's amazing. But visioning is a little different, because it's not right before they die. It's a month before they die. They're still sitting up and talking to me and eating a sandwich, talking about their dead relatives.
And they're like, my dad's standing over there in the corner and he's telling me he's waiting for me.
Yes.
And they feel very comforted, like they're unfazed by it, or are they like, what is happening?
Well, it usually has already been happening. So like when I get there to visit, the wife sometimes or someone will be like, hey, just so you know, weird thing. Like my husband's saying that his dad is here, blah, 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 blah. And then the husband will be like, it shocked me at first, but now I'm kind of like, hey, this is great. Like, and now it's comforting. So I usually see the aftermath of it. I'm not usually there like right when they see them. It's like they're explaining to me what's going on. And people are never afraid though. Usually it's like, I was so afraid. And then last night at the foot of my dad was there, and he said, I'm coming for you. You still have time here.
So beautiful. And it makes me want to cry.
I know. And then they'll be like, and now I'm not scared. All the time. All the time. And not everybody. So I would say the majority of people, it's about a few weeks to a month before they die. And they're like that. It's lucid. And they know what they're talking about. They know what's going on. Some people, it is closer to their death, and it's like someone with like dementia. So people who like can't communicate like that, right? People who are already confused or have dementia. A lot of times how I'll see it manifest in them is when they're not actively dying yet, but kind of getting close to we'll call it transitioning, like kind of like they're doing well, and then they're transitioning to actively dying. They will say things like mama, or start calling people's names that have been dying, or like looking up and smiling, because they aren't really lucid enough anyway, baseline, to have a conversation about like, my dad was here. Sorry,
go ahead.
No, that's it. Go ahead.
Have you ever had a shared death experience?
Yes. Oh my God. That's one of my
I know.
favorite.
I saw it.
Oh, you saw it. Okay. I was like, damn, girl. Yeah.
I
So
saw
I
that one.
I didn't know it was called a shared death experience. Until I told people about it, and then they're like, that's a shared death experience. So yeah, it was with a gentleman that we got really close with. I say we, like the hospice team in general, were really close with him. I mean, I think all of us are really close, but whatever. This man like hit different a little bit. And I was his case manager for many months, and like we had tons of conversation. It was like it's not always that like every hospice nurse gets to talk to their patient specifically about their death, right? But this guy happened to be like really into talking about like, what's death going to be like? Is there an afterlife? Like he was really into that. So like him and I would always talk about it. And I never claimed to know. I'm always just listening and talking. And I think it's an interesting thing to discuss. Anyway, so he is actively dying in his house, and a continuous care nurse is there with him. And I, as the case manager, go in to just check to see basically how the actively dying process is going and make sure he's comfortable. So he was unconscious, and I could tell he was going to die that day just by how he was breathing and how he looked. I could tell like today's the day. So I said my goodbyes like in the house, and I told a continuous care nurse like, hey, can you text me like when this happens just so I know? She's like, totally. So I leave. I said my goodbyes and I leave, and I'm in my car, and I was like kind of happy for him and like thinking in my head, like, you know, I hope everything goes well. I hope you have a peaceful, great death. Like, yeah. And just sort of thinking about it. And I would say it almost feels like I was like transported, like for like all of a sudden I heard his voice in my head talking to me. And when that started happening, I felt like suddenly I would start feeling these like crazy, super intense feelings of like freedom, like a freeness, like an overwhelming feeling of like peace and joy. And I guess like happiness, like so much so that like instant tears, like weeping from like tears of joy. And I could hear his voice, and his voice, it was so funny because he wasn't saying anything profound. He was like surprised. He was going like, oh my gosh, Julie. Oh my God, Julie. Oh my God, Julie. Over and over again. Oh my gosh. Like excited. Like, if I only would have known, I can't believe this. I can't believe this. And he didn't actually say, I can't believe how good this is. But the feeling was, I cannot believe how good this is. Mm-hmm. If I only would have known, because he feared death. He was afraid, you know, and not like struggling, I'm so afraid, but like he would talk about like, man, I don't know what's going to happen. I'm kind of afraid, you know?
Right.
To feel and hear him being so excited and so like, oh my gosh, if I only would have known, this is so amazing. Again, he didn't put those words in, but the feeling was that like, if I only would have known, I cannot believe how good this is. I felt like I could see a smile on his face. It was strange, right? This kind of stuff like doesn't really happen to me. So I didn't know what was going on, but talking about it afterwards, it was like, he was giving me his voice. I could kind of get like a vision in my head of like him, which was him kind of like soaring and smiling. And then I had the feeling of that too. I had this feeling of like soaring, freedom, joy, peace. And I feel like he was showing me what it was like to die. And again, I can only tell you this now that it's happened. During the time I was like, it feels like I was transformed to like another space in time. Right. For like 30 seconds. And then I was like back on Earth.
Psychedelic experience, like a non-medically induced psychedelic experience.
I know. And then I was kind of back in my body being like, oh, what the hell? You know, like, and I got a text from the girl inside, the nurse inside, who said, so-and-so just died. I mean, like right after, like I came back down, text, so-and-so just died. And I thought, yeah, that checks out, because I didn't tell her, because I like for a while, I was like shell shocked. I like sat in my car, like, what the hell is that? You know? Right. And I did call my best friend probably like an hour afterwards, being like, dude, I don't know what just happened, but she's a nurse too. And we're just really close. I was like, I feel like I had like a really weird experience in my car earlier. It was wild. And years, like I didn't really talk about it. And then I started being like, what? People always ask why I don't fear death. And that's like one of the main reasons why. Mm-hmm. And I just don't share it. And then finally I was like, screw it. Why don't I just tell people?
It's so amazing and so comforting.
Yeah.
And I think that there are, did you read William Peter's book?
No, but I haven't. I haven't. I'm just bad at reading.
Listen, I don't know, skim. You could just like pick a couple because it's all people's, anecdotal stories. And it's so amazing to hear these people's experiences of like when they have these spontaneous transformational spiritual, like shape shifting, like the room gets weird or whatever it is. It's just, God, there's just so much we don't know. It's amazing.
I know. That's what I mean. I know I don't know, but I just truly believe there is something like I don't want to have an opinion enough that I have to like hold on to this opinion and like try to get people to believe that opinion. Right. It's like, no, I believe there is something. I don't know what that something is, but I know it's good. And I know everyone's going there. Whatever there is. Like,
right. And that's what's amazing. That's what got me to a place where I could actually do this podcast was like, I don't care if other people believe it or don't believe it. I just want to show them and tell them stories of these experiences that so many people have that don't talk about because for the same reason you didn't for quite some time, I would imagine. Like you don't know what people are going to say. You don't know what they're going to think. How are they going to dismiss it? And when it's and I'm like the medical professional trying to educate about death and dying. And then I have these like mystical stories, right? And also, but what's so great is like the more, and this, I truly mean this, the more I'm around death and dying, the more like those two things are mutually exclusive. Like to me, the fact that our bodies can like biologically die and they know how to do it and they can take care of us is just as spiritual and magical as like me having a shared death experience. Like all of it's the same, like that, like we are divinely made. Or however you want to say it, like it's a miracle to me that there's like built-in mechanisms to help us die. It's a miracle that, even when I just get sick and I'm like, last week I didn't feel great. Suddenly I do. It's like, how did my body do that? Like it just knew what to do to make me feel better. I didn't take anything. Well, I took supplements, but like, other than that, it just healed itself. Or even like if you get a cut, you're like, oh my God, or a bruise. Yeah. You're like, wow. Yes. It's really so remarkable. And for you to be able to witness that process has got to be. Yes. Well, I think too, like if we want to talk about, yes. And there's something that happens. And I've always kind of been a seeker ever since I've been a little girl. I mean, I've always had this spiritual side to me, even as without parental influence, nothing. It was just like in me. And the same feeling that, I almost said his name. The same feeling we could have cut it out. We could have cut it out. Okay, good. The same feeling that my patient gave me with that shared death experience, I've felt before. I have felt that feeling before. It was like a little more detailed because he was in my head, like saying things, and it was me and him sharing that moment, so it was a little different. But that feeling of overwhelming freedom and like a home feeling, like and it's peace, like yes, it's like a familiar feeling of like, oh, I'm almost homesick for a place I once knew. Like I feel like we're going to a place that we have already known. And that's why it's not scary. And I get that feeling when I watch people die. I get that feeling. And I get that feeling whenever I'm not a labor and delivery nurse, but I always think if I didn't do hospice, I would do that. Those people are as, I assume that that hospice nursing and labor and delivery are like, you are both God, as close to God in my mind, having had 3 kids as any. I haven't had kids. That's why I don't do it. Because I'm like, I haven't had kids. I can't even try to imagine. But I would say if I didn't do hospice, I would do that. And I still might do it because I want to see what it's like. But when I watch videos, not that I do this all the time, but I've seen videos of live birth, right? I weep because it's the same feeling. It's like the baby is coming in on like angel breath or something, where it's like, or even if I look at a baby, it's like, where I have a video about this, but it's like, I can look at a baby and think like, where were you, baby? Right. Like not in your mother's womb, but like before, like, where were you? Because I feel like when I look at you, you were at a place that I once knew, and I can't wait
to be there again.
Mm-hmm.
And that is how death feels. And I think I can feel that because I'm not the one experiencing grief, right? Grief can it's hard. It's sad. Like you're losing this person you love so dearly. Right. And because I'm removed from that, I just see the beauty in it. And that's what I want people to understand. Like you could, and I get it. When you're grieving, you're not going to necessarily see it like that, but
because you have all the other feelings that are compounded by loss, right? That you just can't get out of because you're human.
Yeah.
How do you feel about living? Given that you face death every day, like how do you feel like it's changed or shaped how you live, or has it?
I feel like the only thing that hospice has done is help me, hospice wouldn't really, I love it so much. I just don't think death is like the worst thing. So like, it does give me it gives me gratitude to be in a place where like, I love my job and I love my work and I get to connect with people all the time. But it doesn't make me be like, and I'm so grateful I'm not dying. Like, that's not how I feel, because I just don't think death is the worst possible thing. But what it does help me do and understand is that like life is about, to me anyway, life is about like connection. Like, like that is what hospice has given me, is like knowing that life is about connecting to people and about like, that's it. I could go on it, but like that, like simple as that. It's about like connecting with people, living in community, like being there for each other, loving each other, like tolerance and compassion. Like it's one of my greatest joys, being able to like witness people love each other so much. Like, it's like, damn, that is what the only thing that matters. It feels like in that moment is like, this is the only thing that matters. But I have lost some really close people in my life when I was younger to like tragic kind of like sudden deaths. And those things have helped me understand life too, and not take life for granted, and to not hold grudges, and, and tell people I love them, and do the things that scare me, and be easy on myself, and be, like those deaths have profoundly shaped how I live my life. That makes sense. Yeah. Which is, I try to, my main focus in life is contentment, is to be content, is not to like reach out for other things, to achieve things. Like that's not, at least for me, that is not what fuels me. What I want is peace and contentment
and connection. I love
connection,
because I mean, I couldn't agree with you more. Like those moments, whomever they're with, or what it's all about.
Yes. And a big way to have contentment and connection is by having a connection to a higher power, my own personal higher power, nothing religious about it. Well, of course that's okay if it is, but mine personally is not. And service to others. In a boundary setting kind of way, because that can get a little murky, but like, like, and that's another thing I've really developed is boundaries. But like me feeling, I never understood that like being of service to others can get me out of my own head, which can be a dark place sometimes, and give me that connection, and then give me freedom and contentment and joy. And I mean, I'm really getting off the rails here.
No, I love this. I'm like, I'm sitting here because I have a couple other questions that are more medically based. And I'm like, but I'd much rather be in this space. This is my like happy place too. Like just talking about like the meaning of it all, and how to bring that meaning into your life in a really concrete and tangible way. So you can live with those deep connections. Because from what I'm hearing, what you've experienced at the end is that that's ultimately what matters. And we give lip service to that a lot. What matters in the end, but are we really living in that way?
Yes.
Cultivating those things that matter.
Perfectly said. Yes.
So a couple more, because we only have a few minutes left, but I could talk to you all day. Medical aid in dying. What are the misconceptions? How does it work? Where is it legal? Where is it not?
Perfect. I love that you said medical aid in dying. Let's be clear with that. Let's call it that. Medical aid in dying. Let's not call it anything else. Or death with dignity. Only because, okay, I say that. I guess I'll call it what everyone else. People will say assisted suicide. Talk about suicide.
That's really Jack Kevorkian-y to me. Like,
yes.
That sounds like the throwback to like those.
And I think even then it's not true. I mean, I love Jack Kevorkian, and I thought he was amazing for what he did. But in Canada, so you're not. Oh yeah, no, you're in Chicago. So in Canada, medical aid in dying is a little Jack Kevorkian-ish because doctors do it. Doctors inject you with medicine and you die. So like that does happen in Canada, which I'm all for. I'm okay with. I would feel, even though I'm so all for medical aid in dying, I still would have a hard time injecting medication into somebody and they die. Not that I'm against it. I would just be a little like, oof, this feels very scary to do.
Right.
But they do it. And I don't even think doctors have to. I think maybe actually, you know what? I shouldn't speak on the Canada thing because I don't really know. But I do like what they're doing up there.
Whatever it is.
Whatever it is, I like it. Oh, God. Oh, that's hilarious. But here in America, most people don't know that in 11 states, you can end your own life by drinking medicine if you meet criteria. And the criteria is less than 6 months to live. Actually, I'm sure it varies from state to state, but here's the general thing. Less than 6 months to live, 2 doctors basically signing off at different periods of time. So usually like 1 week and then like 3 weeks later or a month later or 2 weeks later, depending. Another doctor signing off saying, yes, this is still accurate. They still are alert and oriented. They can make their own choices. They can physically take it themselves. There's no mental illness, things like that. And then you get the medication. And then whenever you're ready. So once you get the medication, it's not like a timeline where you have to take it. At least in California where I work, people can hang on to the medication for months and they can never even take it. Or they can take it when you plan on it and then you take the medication and then you die. And I've witnessed this. So when you drink the medication, you will go into a coma or a very, very deep sleep. Within the first 3 to 7 minutes, usually. And like, you're not waking, like you are out. So it looks like they're almost actively dying within that first 3 to 7 minutes. But then their body will take about 45 minutes to an hour to shut down, depending on the person's size and just their body. So some people take hours, but it's usually about 45 minutes to an hour, the ones that I've witnessed.
And then morphine is different, right? I mean, you're not taking it yourself, but it does slow everything down.
Well, morphine's not in this drink.
Right.
Is that what you're talking about?
No.
But
separate.
But you separate. Yeah. Morphine. Oh God. Yes. Thank you for saying that. Morphine is much different. Yes. Morphine does not do that. Morphine. So people have a really big misconception about opioids in general. So because so many people overdose on drugs like that, because it's misused, usually not everybody, but most of the time people who are ODing or overdosing is because they're injecting it or they are abusing it. There's a whole other, like, taking morphine for end of life or for pain is much, much different than someone who is abusing it. And again, like, no shade to the people who are. That's a whole nother podcast. And
I don't touch that.
Yes.
So.
Yes. So like, nothing to do with that. But my whole point is because this is so prevalent, people think it's easy to take morphine and then die. And it's like, no. Like, you have to take a lot of more. I mean, a lot of morphine to have a respiratory arrest, which is what causes you to overdose. A respiratory arrest and die from that. I mean, it's actually difficult. Although there's this population of people that, like, it doesn't seem like it's difficult because they're not doing what we're doing. Does that make sense? So people think I gave him an extra dose, or I gave it to him a little too early, or, and it's like, no, that's not, it's not going to cause anything except for them to sleep more. And then they'll eventually, So it's very, very different. And it's actually very hard. I mean, we've had patients try to overdose and they can't, they don't, they take a boat ton of stuff that they think will help, and it doesn't do anything except for make them sleep for like 48 hours. And then they wake up and they're
Still
they're
living.
okay.
They're like, I'm still here.
Yeah. So
Yeah.
it's much different than the death with dignity medication. That stuff, it does end your life quite quickly.
Mm-hmm.
And then there's no morphine in that, just so you know.
But it seems to me that that's a really like kind thing to be able to allow someone to do if they are in that space. And I think we compare people to our animals, and it's like we are in the death space, I think, much kinder to our animals in terms of how we treat them as they are actively dying.
I know. Obviously it's a personal choice, right? Mm-hmm. So people who don't believe in it or don't, it's like, okay, well, that's I totally respect that you don't believe in that.
Right.
Then just don't take it, but people who want to, I think it's so beautiful. And being someone who's witnessed it, it's so beautiful and it's so peaceful. And talk about the love. Damn, the love you see there is like, right, and anyone's death,
it's happening,
it's happening. Yeah. Like they're literally saying their goodbyes to each other. Mm-hmm. And this person is still able to drink this medicine and know they're leaving. And I don't know, it's just, it's wild. Mm-hmm. I love that I live in a state that we provide that. Mm-hmm. I love it. So, I'm all for it. I think it should be in all 50, I think it should be something that the federal government. Yeah.
Last question, because I know we have to wrap up, but I want to get all of this in. Psychedelics and death care.
I don't know anything about it. I kind of wish I did, but I don't know anything about it. I haven't worked with it. I haven't gone there yet, but you know what? I'm all about new anything. Like, why not try a bunch of stuff if we think it can help, especially if the patient wants it. Mm-hmm. And I've read good things about it. I had other healthcare workers who talk about it and are all for it. I think psychedelics can help with a lot of things. End of life stuff, addiction. I think it's like a new and upcoming thing.
PTSD, depression, anxiety, all of it.
Yeah. So I'm all for it. And I live in California. So you think I would, you think I would have be coming for you quickly. I know. It might be.
Right.
But as of now, I haven't really worked with it, but I'm all for like trying new things and anything that can help you explore anything. I think psychedelics kind of open you up in general, mm-hmm. which is amazing. So, but I don't know enough about it, to be honest.
Yeah, I didn't know if it was sort of in the hospice space at all, how that was
working.
Might be. I know a lot, there's obviously been a ton of research around it, but if there's been any talk about how it could potentially, maybe we're still several years from that, but
it's so hard to because
integrated.
Unfortunately with hospice, Medicare is our boss. So
right.
Unless hospice companies want to do it on their own dime, they're not going to do anything with it. I don't think. Because Medicare is not going to reimburse for stuff like that. Even with like marijuana and stuff, I haven't found that, which is wild because that's like, but so Medicare is the boss. So the boss has to tell us what we can and cannot do, what they will and what they won't pay for. Mm-hmm. And a lot of companies will go with that, which I get it. I understand it's unfortunately medicine's money-making business, but just a whole nother thing I could talk about.
We could talk. Clearly we have many more conversations to be had.
I know.
Julie, Hospice Nurse Julie, as you can be found anywhere. Tell us please where we can find you. This was amazing. You are such a wealth of knowledge. The way you talk about this, you make it so tangible, so normal, which it is. And just very digestible. So please let my audience know where they can follow you, find you.
Thank you. You have been so awesome. It's been so wonderful talking to you. I'm on Facebook, YouTube, Instagram, TikTok at Hospice Nurse Julie. And I am developing a website and stuff now, so I can finally get people on one page if they want to be there. But that's a work in progress. We'll see. But yeah, so on social media at Hospice Nurse Julie, you could find me there.
And I saw you got a book deal.
I got a book deal. Oh man, Wow. Crazy. That's not coming out. I didn't know how long this kind of stuff was going to take. So my book will be out, they think June 2024.
Okay.
So it's actually almost done. So it's almost done, which is wild, but it's going to take a year to publish. Yeah.
That's awesome. That's
yeah,
awesome.
I'm excited.
Well,
I'm
when
excited.
that comes out, I'll have you back on to promote
Yes.
if you're up for it.
I'm up for it. Of course. Thank you so much.
Thank you so much.
All right. Well, have a good day.
All right. Thank you. That was awesome. You're awesome.
Oh my gosh. Thank you so much. I'm so sorry we only had an hour. I seriously could talk to you for ever.
I know. That's how I feel too.
I hope I didn't go on too much of a tangent. I can hear myself sometimes being like, blah, 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 blah.
No,
I'm like, oh,
I can pull people back, but I'm like, my audience will like this. I know what they like. So,
okay, good.
Yeah, this was just amazing. You're amazing. I'm so glad to know you. And
same.
How I can help you. I just am first starting the book process. So I'm like,
oh my God, it was wild. It's wild.
I know you have to go. Who's your publisher?
My publisher is Penguin Random House,
Okay.
But it's an imprint. Oh my God, I should know how to say it. I don't know. It's something like Tetchery Perry or Pedigree or something. Okay. It's an imprint of it's an imprint of Penguin Random House. Yeah.
Got it.
Where they're like, yeah. So I mean, I got a really good agent. I mean, it's a whole I could really talk to you about it, but like my agents did like everything because I was really anti-book. I was like, I don't really want to write a book. I feel like books have been written. I don't read books. Like, I feel like that's like inauthentic. I don't want to do it. And they were just like, that's fine. We'll do it. We'll do everything for you. And I was kind of like, yeah. And then they made this really great proposal and I was like, holy shit. And I did give them some writing samples and stuff of stuff I'd want them to do. And then they got a book deal. I mean, it just was like, I think it happened how it normally doesn't happen. I don't, so I just feel really, really grateful. And now I'm excited about it. I mean, originally I was like, I don't know, but I can't believe it. Yeah.
I know that I was in the same. We should just chat another time.
Yes.
I'd love to hear about it. And I'm like in the beginning process. So
if you need a book agent too, I don't know if you already have one or not.
I'm waiting for a contract back. I know you got
Okay, great.
I won't.
I got it. Okay.
DM or talk or something, whatever. I'll DM you.
Okay. Thank you. Have a good day.
Julie, you too.
Bye.
Bye-bye. Like what you heard today and want to hear more? Wondering what comes next and what it all means? Head over to Apple Podcast, Spotify, Stitcher, Google Play, or anywhere you get your podcasts and hit subscribe. Also, if you could take a minute to rate and review my podcast, I would really appreciate it. Stay tuned as we continue to explore life, death, and the space between.